Hello everyone, I'm Dr. Emily Sanders, and today I'm going to share with you the ugly truth about what older women reveal at medical appointments and how it can sometimes unintentionally harm their health. If you're an older woman or care about one, this video is a must-watch. Stay with me until the end because I'll also share crucial tips to protect your health and make your medical visits truly effective. Before we dive in, please like this video. Comment below if you've ever felt hesitant at a doctor's appointment, and subscribe for more honest medical insights designed especially for women over 60. Part 1. The hidden danger of oversharing. Why saying too much can harm your health. Many older women come into medical appointments with a sincere desire to be open and transparent, and that's a wonderful instinct. Honesty is absolutely crucial for doctors to provide accurate diagnoses and effective treatment plans. However, here's the ugly truth. Sometimes sharing too much information, especially details that don't directly relate to your health concerns, can actually cause problems. Why? Because doctors generally have limited time, often only 10 to 15 minutes per patient, and their goal is to zero in on the most pressing health issues as efficiently as possible. When the conversation drifts into unrelated stories, anecdotes, or concerns about others, it can distract from the symptoms and signs that truly need attention. Imagine this. You walk into your appointment, and because you feel nervous or want to connect, you start talking about your neighbor's noisy dog, your friend's recent hospital stay, or your granddaughter's school troubles. While these topics may feel comforting to discuss, they do not help your doctor assess your health. What happens next is the doctor tries to sift through a lot of unrelated information to find clues about your symptoms, but this can lead to delays, missed details, or even misdiagnosis. In some cases, important symptoms are buried under layers of unrelated chatter, making it harder for doctors to recognize early warning signs of serious illnesses like heart disease, cancer, or diabetes. These conditions often present with subtle symptoms that require focused attention. To protect yourself, it's helpful to prepare before your appointment. Write down your main concerns and symptoms in order of importance. When you speak with your doctor, try to stick to those points first. This will allow your doctor to spend the majority of the appointment addressing what really matters, your health. Part 2. Underreporting symptoms out of fear or pride. What you don't say can hurt you. Now, the opposite problem. Many older women don't report important symptoms, either because they believe these changes are just part of aging, or because they feel embarrassed or reluctant to complain. This is a very common and dangerous situation. I see it in my clinic all the time. For example, a patient may say, "Oh, I'm just a bit tired," or "My memory is not as sharp, but that's normal at my age," without realizing these could be signs of underlying issues like anemia, thyroid problems, or even early-stage dementia. Pride also plays a huge role. Many older women grew up in a culture where toughness was valued, and admitting to health struggles might feel like weakness. They might say, "I don't want to bother the doctor," or "I can manage on my own." But this silence can be deadly. Symptoms like persistent fatigue, unexplained weight changes, chronic pain, or mood shifts are red flags that deserve professional evaluation. When these are hidden, doctors can't intervene early, and the condition may worsen. Fear is another reason. Some women fear that reporting symptoms will lead to more tests, invasive procedures, or medications they don't want. Others worry about being labeled hypochondriacs or difficult patients. I want you to know this. Your doctor is here to help, not judge. No symptom is too small or too embarrassing. Remember, early detection saves lives, improves quality of life, and can even prevent complications. If you're worried about how to bring up difficult topics, consider writing your symptoms down privately or asking a trusted family member or friend to accompany you and help communicate your concerns. Part 3. The problem with self-diagnosis and internet influence. Why Google can't replace your doctor. In this digital age, most of us turn to the internet before seeing a doctor. It's easy to understand why. Google is available 24/7, and searching symptoms can give you a sense of control or preparation. But here's the ugly truth about self-diagnosis, especially for older women. Online information is often inaccurate, incomplete, or frighteningly misleading. Many patients come into my office convinced they have a particular illness based on something they read online. Sometimes this is harmless curiosity, but often it leads to what I call diagnosis tunnel vision. Patients may insist on a diagnosis that matches their research, even when their symptoms suggest something else. For example, a patient might come in convinced they have a heart condition because they read about chest discomfort on a forum, but in reality, their symptoms might be related to anxiety or acid reflux. Conversely, they might dismiss real heart symptoms because Google didn't say it's serious. Another common issue is patients rejecting my medical advice because it conflicts with what they've read online. They may refuse medications, insist on unnecessary tests, or delay treatment, which can have dangerous consequences. Doctors absolutely want their patients to be informed. Being educated helps you participate in your care and ask better questions. But it's vital to remember that internet searches don't replace the years of training, clinical experience, and diagnostic tools doctors use to see the full picture. If you're worried about information you've found online, bring it up with your doctor. Say, "I read this online, what do you think?" This opens dialogue and allows your doctor to address misinformation, explain your condition better, and reassure you. Part 4. The fear of medication changes or new treatments. Why silence can be dangerous. One of the biggest challenges I see in my older female patients is fear or hesitation when it comes to medications, whether that's starting a new drug, changing an existing one, or reporting side effects. Many women worry about rocking the boat. They don't want to seem difficult or ungrateful, so they stay silent about problems they experience with their medicines. Others fear the potential side effects or the idea of adding one more pill to their daily routine. This fear sometimes comes from past negative experiences or stories from friends and family. But here's the harsh reality. If you don't tell your doctor about side effects, or if you don't share concerns about how a medication affects you, it can lead to serious complications. Side effects can worsen, medications might interact dangerously with others, or symptoms can be masked instead of treated properly. For example, a medication might cause dizziness or confusion that could lead to a fall, a major risk for older adults. Or a drug might interact with another you're taking, causing unintended harm to your liver, kidneys, or heart. Doctors cannot help you adjust your medications if they don't know what's really happening once you're home. That's why it's so important to keep an open line of communication. When you start a new medication, ask your doctor or pharmacist what side effects to watch for. Keep a medication diary if you need to, noting any changes in how you feel. If you experience anything unusual, don't wait for your next appointment to mention it. Call your doctor or nurse and let them know. Remember, no side effect is too small to report. Also, if you're ever worried about starting a new treatment, speak up. Ask why it's necessary, what the benefits and risks are, and if there are alternatives. Your doctor wants to work with you to find the safest, most effective plan, but that can only happen if you are honest and proactive. Part 5. Not asking questions. The silent harm that leaves you in the dark. Finally, one of the most overlooked but dangerous behaviors I see in older women at medical appointments is not asking questions. Many women feel rushed, intimidated, or afraid they might annoy their doctor by asking too many questions. Some assume the doctor's instructions are clear enough or don't want to appear difficult or uninformed. But the truth is, if you don't understand your diagnosis, treatment plan, or what symptoms to watch for, you're setting yourself up for potential harm. Misunderstandings can lead to missed doses, taking the wrong medications, or failing to notice warning signs that need urgent care. It can also cause unnecessary anxiety or confusion about what to expect. For example, a patient who doesn't fully understand her diabetes management plan might misinterpret dietary advice or medication timing, which could cause dangerous blood sugar swings. Here's what I tell my patients. No question is too small or too silly. If you don't understand something, ask for clarification. If you forget something during the appointment, write it down and ask later. Most doctors and nurses are happy to talk with you. Bringing a trusted friend or family member to your appointment can also help. They can listen, take notes, and remind you of questions you wanted to ask. Remember, the goal of a medical appointment is partnership. You and your doctor are a team working together to keep you healthy. That means communication has to go both ways. So next time you leave a doctor's visit, make sure you're clear on what your diagnosis means, what medications or treatments you should follow, which symptoms require urgent medical attention, when to schedule your next visit. Being proactive with questions isn't just about being informed. It's about taking control of your health and preventing avoidable problems.